Good afternoon, doctor. Coming to you from Sunion, Greece. Still in this beautiful, beautiful place and enjoying every minute of it. It's always amazing to me how blue the water is and how blue the sky is. Of course, they reflect each other. And that makes me think of how we all reflect each other. So all of that comes together in what I'm going to talk about. I'm deciding today to talk to you, or I decided to talk to you about how you can get about 98% treatment acceptance in orthodontics for your patients. Your patients, first of all, let me say, already want you to treat them. They are in your general or pediatric practice, and they adore you already. And they feel your capability, your caring, your love, and they already are happy there. And so you've got a great start because they would like for you to treat them. I have doctors tell me all the time that patients say, well, can't you do it? Can you just do it and not refer me out? All right, so there you start, and you're way ahead of the game for any specialist to whom you might refer for anything, because they already know you and trust you. So that's a good start. But the next thing that you have to understand is that why they feel that way is totally because of the love that you give them. And you can even ramp that up, because when you think about it, you love them dearly, you're very appreciative of them, and you care for them, and you want to care for them. So why would I say ramp it up? Don't you already have everything that you can have in love for them? No, because you're busy with all the stresses of your day. You're busy because someone's calling you for hygiene checks. You're busy because somebody's on the phone and you've got to make a decision about some insurance problem, some corporate problem, some other problems that are coming along. So the reality is that you are not able to show your patients fully how much you care for them and that you have them first and foremost in your sight. So the first thing I'm going to suggest is you understand that if you can get more present, if you can get more intentional with everything you're doing throughout your day, and that goes for staff as well as your patients, and of course it goes for family too, by the way, you're going to find that people feel your love and caring a lot more. You see, it's already there. When you went to dental school, you did it for a reason. And that reason was in great part so that you could take care of people, be good to people, help people. And you want to do that, and you still want to do that. So now I'm telling you some of the things that limit the patient's understanding of that from you. And that's what we're talking about. So ramp it up, be more intentional, be more present, be more on board with what's going on in the moment. Stay in the moment and enjoy your patients. Try your very, very best to get rid of all the thoughts that have nothing to do with that patient as you're talking to them. To get rid of all the thoughts that have nothing to do with their needs, so that they understand what you're about. Because that is just going to endear them to you more and you to them more. And that's what it's about. That's why we call it love and orthodontics. Now, I want to remind you that even when you go home, it's important that you do this for your family. It's important that you make eye contact with your family members, with your wife or husband, with your children. And when you talk to them, you are looking right at them. So many times I find myself not doing that. It's important to make eye contact, because then you're also making mind contact. You are not only communicating that you're paying attention, but you're really paying attention. So that's something to think about from the family standpoint all the way through to the staff standpoint, all the way through to the patients. And I'm going to tell you that that's a big part of it. Now, in later videos, I think I would like to tell you more about preparing your information for your patient and how you can give them a plan of treatment that's going to be so much more impressive for them, because that's a big part of it too. But you are so far along the line of letting them know you love them and care for them and getting their acceptance on your treatment planning when you are just present with them. So those are my thoughts for today. I'm going to go back to looking at this beautiful sea out here and wishing you the very best day in the world. So Dr. Chris, signing off.